A warm good evening, everyone. It's a great Sunday today. It's the fourth day of the International E-Conclave. Very interesting day because on the last 4 days we have been, since the last 3 days we have been speaking about a lot of things about pharmacotherapy related to tobacco cessation. So because now we are moving towards the panel discussion.
And let's have those brief but very critical remarks, gems of wisdom, experience, advice from a panel that I think I'm more than privileged to moderate. Dr. Shanmughasundaram is from the Cardiological Society of India from Chennai. Dr. Shanmughasundaram, please.
Good evening, dear friends. I'm a hardcore clinician. I'm not supposed to underestimate the role of drugs in achieving the tobacco cessation, but I firmly believe that my words carry more weightage, particularly when I counsel my patients at the right moment. For example, if the patient sustains an acute event, even on day one, when I see them in the intensive care unit, after I examine and tell them about the illness, I make it a point that your illness is caused by tobacco, smoking or chewing tobacco. Very, very important to stop smoking, much more important than, taking your cardiac medications. Similarly, at the time of discharge, I see to that I, repeat the, counseling about, cessation of smoking. During my outpatient visits, if I spend about, 10 to 15 minutes with each patient, I at least spend 2 minutes with each of them in lifestyle modification, particularly about this smoking habit. Even those quitters, I make it a point each time I verify that they remain abstinent. Because some of them do have relapses, so I have to find out at the right time and motivate them. The interesting instance which Dr. Murthy was telling, I invariably utilize the grandchildren to carry on my messages when the patient goes home, because the grandchildren do have a lot of influence on their grandparents, so it works very well in making them remain abstinent. Then some of them, who sincerely wish to stop smoking or tobacco chewing, but are not able to do it. I send SMS 1 week after my outpatient visit, a month later and 3 months later, like that. I follow it up with SMS done by my secretaries. This is the way I do, and I focus mostly on this age group of 35 to 45. Anybody who is going to quit is going to be benefited, but most benefit is going to come through this middle-aged people. So I see to that they get the proper counseling. Thank you.
Thank you so much. That's very useful.